Hello everyone, my name is Judinica Saint Pierre and today I'll be presenting the findings from my from my research project on a topic that is highly relevant to our lives and communities. The influence of social media health information on health perceptions and behaviors among young adults in Port-au-Prince, Haiti. The goal of this project was to understand a modern mass communication problem and propose a solution. And I am really excited to share what I found with you today. To get us started, I want you to imagine you have a question about a new health trend, okay? Where's the first place you look? For many young people in Haiti, that first place is likely to be Facebook or TikTok. While these platforms can be great for sharing information, they are also a breeding ground for misinformation and unverified advice. This presents a serious communication problem that can have a real world health consequences. My study was designed to investigate this problem directly and to use my findings to propose a practical solution for our relevant organization like OMS, okay, the Mondial Organization of Health. The research question and methodology. The central question guiding our research was, to what extent does exposure to social media health information influence the health perceptions and behaviors of young adults in Port-au-Prince, Haiti? To answer this, I used a mixed methods approach. I first conducted a quantitative survey with 200 young adults to gather broad data on their social media habits and health beliefs. Then I followed up with in-depth qualitative interviews with 20 of those participants to get a deeper understanding of their experiences and thought processes. My findings on health perceptions were quite striking. As you can see it from the data visualization, a significant majority of our participants, 75%, feel that social media directly influences their understanding of a healthy lifestyle, okay? Especially for the millennials generation, Gen Z. But perhaps even more critical is that I found in the interviews many young adults tend to trust personal testimonials from social media personalities, okay, over the advice of doctors or health organizations. This creates a clear trust gap that is a major obstacle for public health efforts, okay? The people we call influencers, people, young adults tend to trust them more than the advice of doctors or health organizations. Moving from perceptions to actions, the data showed a clear link between social media use and changes in health behaviors. Almost all of my surveyed group reported trying a new diet or workout routine based on something they saw online, okay? The most concerning finding, however, was that a significant number of participants admitted to self-diagnosing an illness after seeing symptoms described on a social media post, okay? Sometimes even me, I do it, okay? I feel something and without going to a doctor, I do some researches on social media on Google, and I say to myself, okay, I have this illness. Okay, this highlights a critical need for intervention to prevent potentially dangerous health decisions. After analyzing our results, it's clear that social media is not just a passive source of information. It's an active influence on young people's health decisions. The data speaks for itself. However, it's not as simple as social media is bad, okay? My interviews show that young adults are making nuanced decisions based on who they trust and how relatable the content is. This means that any solution must be equally nuanced and consider these factors to be effective. I also want to take a moment to critically evaluate my own research process, okay? The biggest strength of my methodology was the mixed method approach, which allowed me to combine the what from the survey with the why from the interviews. Okay, I was able to interpret the numbers and the reason behind the numbers. This gave me much more comprehensive picture. However, there were some limitations because my surveys was online. I have missed a segment of the young adult population without reliable internet. Additionally, since I relied on participants' self-reported behaviors, there is always a chance for inaccuracies. In conclusion, my research has made it clear that social media is a dominant force in shaping the health perceptions and behaviors of young adults and powerpoints. I've identified a significant gap in trust between these young peoples and traditional health authorities, with many choosing to believe online influencers instead. Okay, the mass communication problem is this: how do we combat misinformation and build trust? Okay, how do we combat misinformation and build trust in this generation? The answer is not to abandon social media, okay, but to leverage its power strategically. We must do what we call media literacy for the young people. Okay, with media literacy, they will understand that they don't, it's not good for them to trust any information they saw in the internet. Some recommendations and call to action. Okay, based on my findings, my final recommendation is for the Ministry of Public Health and Population to develop a new communication strategy. First, they should partner with popular and respected Asian social media influencers. Rather than fighting them, they should work with them to disseminate accurate information. Second, they should launch a digital literacy campaign to teach young adults how to spot misinformation. Okay, with media literacy, they will be able to do it perfectly. And finally, they should use social media as a two-way channel, allowing people to ask questions and get real-time and verified answers. I think this is a powerful, low-cost way to reach our target audience and begin to solve this problem. Okay, it's the end. Thank you so much for your time and attention. I am now happy to take any questions you might have about my research, my findings, or any recommendations. Thank you so much. You can write the recommendations in the comment sections. Bye bye.